Okay. So we're going to move forward with today's meeting. So the first thing that we want to just quickly talk about are ways that you can stay connected with College Democrats at UCF if you have not done so already. The best way to reach us is on Instagram at DemsUCF. We do also have a Twitter at DemsUCF and a Facebook, as well as if you have any inquiries of any kind, demsucf at gmail.com. That way that you can send us emails about particular things if you have questions about stuff, or maybe if you're an organization interested in getting involved with us, we do respond there. So be sure to use that. And we also encourage everyone, if you are not already on it, to join our Slack channel, to use the QR code. That's an area that we can directly communicate with members. And we try to, especially moving a bit further now, post about different opportunities that you can get involved with. And just in general, just be more directly connected with our organization. So moving right along, if anything, Gabby, if you want to just present this briefly.
Yeah, so really quick, if you do want to become an official member of our club for the semester, Venmo or Cash App us $15. Um, that's pretty much it. Yeah.
Yeah. Just so you are aware, you do not need to be a dues paying member to attend these meetings, as well as that $15 mostly goes towards your ability to vote in our elections in the future. And then in a normal year, there's other things that it contributes to, but that's mostly what it is right now. But like I said, you're free to come to all of our meetings, even if you don't pay the dues, but we encourage you to do so. So before we do our main event of the night, we have a couple brief current event updates for you guys, just some stuff that's Florida specific and nationwide. So for the first one, I'm going to pass it over to Matthew.
All right. Hey, how's it going, guys? So, I mean, we all follow the news. Unfortunately, Donald Trump was acquitted. And one of the things that me and Dylan, we wanted to kind of applaud and also point out is, as you can see to the right, these are the Democrats that they were the ones that did the questioning and handled the impeachment trial. So we applaud them and we thank them. And unfortunately, we need 67 votes in the Senate in order to impeach the President of the United States. And not enough Republicans wanted to flip over. And we can thank people like Mitch McConnell, for example, for being too fearful and wanting to maintain power to not have switched over and impeached Donald Trump. It was a part by basically probably the most bipartisan impeachment in the entirety of US history. Everybody just basically voted along the lines of their party. And, it was an unfortunate event. It was a complete outrage. And I think all the people that are here in the College Democrats today can agree and can attest that this was a horrible result and unfortunate and an injustice to the officers that passed in results of the riots.
Okay. So like Matt said, it was the most bipartisan impeachment in U.S. history, which is still a very big symbolic win, but a symbolic win is not a win. And most of those Republicans, I would add, have now been censured by their state parties for doing so. So they've basically been reprimanded by their state parties for making that decision. It's also worth noting one specific example is Louisiana Senator Bill Cassidy, who was a Republican nobody expected. He was censured by the Republican Party of Louisiana. That's the same Republican Party of Louisiana that didn't censure former Grand Wizard of the KKK, David Duke, back in the late 80s when he was running as a Republican in the state of Louisiana. So it just shows where their priorities are. But moving right along, okay. We're going to show that anyway. My slides have been great today. Florida's COVID-19 update. So right now, when we look at the state of Florida, our current death toll today actually reached above 29,000, with 225 contributing to that today. Current vaccinations are pretty much a complete disaster, regardless of what DeSantis would say. But right now, about 40% of seniors have been fully vaccinated. That's nowhere near the numbers that we were expected to be at, and a lot of that can contribute to Ron DeSantis's continued incompetence. The other thing to make note of is that people under 65 are still unable to receive the vaccine in the state of Florida because, unlike CDC guidelines and just general health common sense, Ron DeSantis has decided to prioritize people above 65. He also specifically, in one press conference, basically said we're prioritizing people in desirable areas. So places like the Villages and other Republican-leaning areas in particular have benefited from Ron DeSantis's vaccination program. A couple just quick brief updates is that the sole appointed Democrat that was appointed by Ron DeSantis, Jared Moskowitz, who heads Florida's Division of Emergency Management, is resigning next month. He expressed mostly about wanting to spend time with his family and all that as his justification, but that's a significant blow to our ability to actually roll out the vaccine and just have a general competent person in the Division of Emergency Management. So I fear for whoever the next director will be. And then two other quick things. One is a company that's come under a lot of scrutiny lately is Publix, both for funding the insurrection that happened on January 6th indirectly, and also through what people are starting to criticize more and more as the contract that Ron DeSantis did with Publix to become, for a while, the sole provider of vaccinations in the state of Florida when it came to actual companies. This was criticized because Ron DeSantis and Florida Republicans received tons of donations from Publix throughout the 2020 campaign. So it very quickly feels and is effectively a quid pro quo that Publix did. So that continues to be a problem. And then one issue in particular that our local reps, Ana Escamani and Carlos Guillermo Smith, have been very involved with was a recent issue with Walmart, which was another company that eventually got rights to the vaccination that effectively a couple days ago on their website, they made an error that allowed people under the age of 45 with comorbidities to apply for the vaccine appointment. And then when they realized that mistake, they got rid of it without telling anybody that had actually applied for the vaccine if they would be able to get it or not. And since then, through our state reps and other people across the state, we've been able to get kind of a confirmation from Walmart that they'll honor it, but it continues to remain to be seen. So we'll see more throughout the week, whether they do or don't. So the last two quick things that we just kind of wanted to put on everybody's radar before we begin is just some people that we think you should definitely watch because we have two major races coming up in 2022 that a lot of people are already gearing up for. So the first one is the 2022 gubernatorial race, which will be the person who will challenge Ron DeSantis next November. The image that you can see is the map of the 2018 election result. And that was one that Ron DeSantis barely won. It was one of the closest in Florida history. But we are hoping that in 2022, we can flip that. So some of the people that I would encourage you guys to just kind of be on the lookout for, the biggest one being Agricultural Commissioner Nikki Fried, who's the only Florida statewide elected Democrat. Another one is our hometown hero, State Representative Ana Escamani, who would definitely be the progressive candidate in the race, as well as other more moderate candidates include former Congresswoman Gwen Graham, State Senator Jason Pizzo, and State Senator Annette Taddeo. And then the other person that is now being floated more and more for yet another governor run is Charlie Crist, who's now a current congressman, but former Republican governor of Florida back in the late 2000s. So he is potentially mounting a third bid after losing to Rick Scott in 2014. So that's lovely. And then lastly, wow, okay. It's been like that today. The other one was supposed to be a map of the 2018 Senate race, but these are just some of the potential 2022 Senate candidates to watch out for. And they include two people that are actually from the Orlando area, which would be significant if either one of them is the nominee. Congresswoman Val Demings, who you guys might know was on Biden's short list to be vice president and is arguably one of the most prominent African-American women in the state of Florida, as well as UCF's Congresswoman Stephanie Murphy is being considered as someone who might run against Marco Rubio. She's also very moderate, so there's that to factor. And then some other candidates that are a little more out there include former Congressman Alan Grayson, former Congresswoman Debbie Muskell-Powell, Congressman Ted Deutsch, and right now the only candidate that's remotely semi-major that announced his campaign is a guy by the name of Alan Ellison, who was a previous Democratic Party nominee for multiple House races, but did not win. So those are just some names to kind of keep on the radar for, especially over the next coming months, because you'll start to see some movement in that area, and we're going to see these races form. And one of the interesting things is that there is a very strong possibility it will be the first time that we will have a Democratic ticket that's entirely female in the state of Florida, because most of the leading frontrunners in both races are women. And particularly, potentially, we might have 2 women of color at the top of the ticket, which would be historic, not just for the South, but particularly for the state of Florida. So just to keep all that in mind. So with that, I'm going to pass it over to Gabby, and we're going to be presenting Disability Advocacy and Etiquette 101 with our Q&A. So Gabby, go for it.
Actually, I was going to start it, but I'll pass it on to Gabby in just a sec. My name is Paola. I am the Director of Diversity and Inclusion. Thank you all for being here. And now I'll pass it to Gabby.
Hi guys, my name is Gabby Hagan. I am also your CFO. For those of you who don't know, I was the Disability Caucus Chair last year. Unfortunately, last spring semester was a semester we got cut short because of COVID. So I'm happy to get to do this event kind of in memoriam of spring 2020 semester and what could have been. But it worked out perfectly, honestly, because I got to have my good friend here. His name is Brad Dell, and I'm so happy he's here. But really quick before we start, I do want to preface and say that I am a disabled person. I have a chronic illness called cystic fibrosis. So I'm also going to be answering some questions along the way, but I'm going to pass it to Brad, and he's going to introduce himself.
Yeah, thanks, Gabby. Can you hear me okay? Cool, right on. So I'm Brad, and I did not go to college in Florida. A lot of my family's from Jacksonville. Pleasant place, not really. And I now live in Hawaii, as most raised there. And I was born with cystic fibrosis. And that is basically a lung disease that has effects all throughout your body. It's a really, really fun disease, causes all sorts of problematic things. And for me, it kind of indirectly led to me going completely deaf and then needing a lung transplant. And so I got my lung transplant at the University of California in San Francisco about 4 years ago. And then I got cool cochlear implants, which allow me to hear now. But upon moving to California, I started a job at BioNews, which is a company that does all sorts of services for people with rare diseases and disabilities. And so in my position at BioNews, I publish columns written by patients and caregivers with rare diseases. And so they're always talking about what life is like to have a disability, what it's like to face ableism, what it's like to have disease and a really corrupted system. And so I guess, Gabby has seen a lot of what I've written and a lot of promotion of really awesome people like Kevin Schaefer, who's also joining us. And so a lot of my knowledge on disability comes from both my experience and then also the experiences of all the people that I work with. And Kevin, you want to introduce yourself?
Sure. Can you hear me okay? Awesome. So yeah, my name is Kevin Schaefer. I also work with Brad at BioNews, and I'm from Cary, North Carolina, and I was born with spinal muscular atrophy type 2, SMA for short. SMA is a rare neuromuscular condition where it affects pretty much all the voluntary muscles in my body. So, and there are various levels of it. So like I've been in a wheelchair pretty much my whole life, but the SMA community is very broad. Because there are different types, there are people who have it way more severe than I do, and then way more mild than I do as well. So it's a really diverse community and diverse spectrum there. And yeah, I went to North Carolina State University, studied English, and knew I wanted to write, knew I wanted to do something in that field. And like Brad, he also was a student journalist in college. I worked for the school paper as well. And then when I got out of college, I was just looking for various freelance opportunities, came across the SMA site that BioNews publishes, and really liked what they were doing. And at that time, it was very small. There was only one columnist at the time, but I was able to connect with her and get plugged in. And so started out as a columnist like Brad, and then now my position is director of forums. So whereas Brad like oversees all of the columnists at our company, I oversee patient and caregiver forums and hire and train moderators. I also do a lot of multimedia content there. So I still write for the SMA site and produce podcasts there. So yeah, it's a great job. And like Brad, I've learned a lot about a wide range of diseases and disabilities out there, and having shared experiences with many people and also very different ones as well. So it's been a great experience.
Thank you guys so much for sharing, and thank you guys so much for working with BioNews and spreading awareness. So we have some pre-written questions, and then we're gonna open the floor later. The first question that we have is, how has the pandemic impacted you personally, and how do you think it has impacted the disabled community as a whole? Kevin, if you want, you can start.
Okay. So when I think about this question, we were talking, actually, Brad and I were talking about some coworkers earlier, and one of the things, particularly wheelchair users get a lot in normal times, is like, oh, it's so good to see you out and all that. There's this like people are like surprised when we're out living normal social lives. So, and for me, that was very much the case. I mean, yes, I work from home, but prior to the pandemic, I was always out and about, movie theaters, and going out with friends and whatnot. And so had a very active life, outside home as well as at home. And so it's affected us just like it has anyone else. I mean, yes, there are plenty of people in the disability community who are more apt to staying at home for, if they're for health conditions, and if they're, they just prefer it. There are a lot who do stay home primarily. So for some, this hasn't been as new, but for many of us, it's been very difficult to adjust to, because like anyone, we need that social so those social outlets and experiences, and so it's been, I mean, for my life, I look at just like my Instagram stories and stuff from like a year ago, and I was like at shows, and I reunited with some college friends and doing all these things, and of course all of that had to come to a halt. And I think too, one of the really hard things is people's attitudes during the pandemic. I think it's brought out the best and worst in people. Some people have been so supportive and encouraging. Others, it's really sad and frustrating to see posts on social media where people say like, oh, well, the virus only affects, high risk people or elderly. And I'm like, so are we no less valuable then to, just because of it? And so that's been really discouraging. But at the same time, it's also brought a lot of us together, and we've been doing a lot of more virtual events and, things like this. It's been really exciting to see more accessibility, I think, in a way, because now a lot of us are having these opportunities that for a long time were denied. A lot of companies didn't see the value in remote work and that kind of thing. So it's definitely had its pros and cons, but I think it's definitely had a huge impact on various disability communities.
Yeah, and for me, it's been, pros and cons. If you were to start with the pros, there's a lot more remote work available, which is great for people who, they can't leave their house very often. For example, if you have SMA and cystic fibrosis, you're not really encouraged to, go to parties during flu season. And so, just going out into the world is always dangerous for us with compromised immune systems. And so remote work has always been a must for a lot of people with disabilities. And it's a privilege to say that, you don't think that work is all that great, because for us, it's a sense of purpose for us, that when we're told our entire lives that, you're just going to be stuck with your parents and always getting taken care of by them, people strip you of your autonomy. That starts to get to you after a while, and you start to think, well, what can I achieve on my own, and how can I do that through work? And I'm sure during this conversation, we're going to go over a lot of different ways that we don't really have the workplace equity that we deserve. You have things like the sub-minimum wage, where people, 420,000 people in America today are paid just $2.15 an hour. And that's legal if you have a disability. It's completely legal. And so I was very encouraged at first. I remember writing a column and having much of my columnists write about how we saw a lot of hope coming out of the pandemic, because we thought, okay, finally people can empathize. They can empathize with the need to have remote work. They can empathize with what it's like to be isolated. And things like that. And, the need for Medicare access for everyone who needs it. And so we went in hopeful. And then, it only took a few weeks for it to all fall apart. Suddenly people don't want to wear their masks. They're, totally disregarding any benefits that the vaccine could provide. It's always about me, and not about the vulnerable. And even now, you look at the vaccine list, how many states, if you're under 65, you can't get it yet, even if you have a disease where you would likely die if you get COVID. So I think that, I went in hoping for a lot of empathy, a lot of built up empathy, but I think instead we saw only the problems laid bare and uglier than ever before. And so it's been very difficult to have a lot of friends who put, their desire for fun or their desire for freedom over the good of their neighbors, over the good of people who, this is a very serious matter. And, you have a lot of people saying, oh, it wouldn't have been economically possible for us to be protective. And, that looks kind of embarrassing for the US now when you look at all these other countries. So it's been really hard. It's been really hard. I think that the systems of ableism are more evident than ever before. So maybe, people will get their act together and act on that and do something about it. But I think a lot of my community are just exhausted with people. They're exhausted with feeling like a second-rate citizen, with, people saying, well, you just wait in your house until it's your turn. We have people who are way more prioritized than you who need to get this vaccine right now. So it sucks. It really does. But I'm a hopeful person. I hope that, we do learn from this and that the disabilities community is treated better as a result of the pandemic.
Yeah, super well said. I also want to add, Brad and I have been hearing the 6 feet apart rule for our whole lives because CFers really aren't supposed to get in close contact with each other. So it was very strange to see that implemented to everybody. And you're like, oh yeah, that's how we live. Okay, but next question is, how does BioNews implement inclusion with and for the disabled community? And how do you think that should be implemented in other organizations? Kevin, you can start.
Sure. So like I said, I started out as a columnist for BioNews and then transitioned to a full-time role a few months later. I was one of the first patient employees hired full-time. And I was really impressed from the beginning at how much flexibility there was, meaning BioNews never questions or makes me take time off when I have appointments. And I have aqua therapy every week, and then I also, I didn't mention this in my intro, but I am on an active treatment, which the first FDA approved treatment for SMA came out a few years ago. It's called Spinraza, and I've been on that since November 2017, and it's requires me to have an injection. I do it in my neck every 4 months, and so because of that, it ends up being an all day thing. And my boss specifically says don't ever take a personal day for that. You can just take time for that. So they're always the accommodations like that in terms of appointments, flexibility has been really great. But at the same time, they're no less, how do I say it? They have just as much expectations of us. Me and Brad both work there full time. We're held to the same standard as any full time employee there. They know, they trust us to do our work and to fulfill our responsibilities, but are also really accommodating when it comes to, hey, I'm really fatigued right now, or I have an appointment, or any of these things. So that has been huge. And the remote work. I kind of mentioned earlier, I'm used to pre-COVID, I was very out and about. I'm very extroverted, and so the thought of working from home was not something I actually planned on. I thought I wasn't sure I could handle that, but it's actually really beneficial to me because it does provide so much flexibility, because that way I don't have to rush in the morning to get up. Because for me, for my caregiver to come in the morning and get me up, it takes a good hour and a half. I can't just get out of bed and get in my chair. So because of that, like I like having the flexibility of remote work. I can kind of start at a reasonable time, have plenty of time to take care of everything I need to, and work around my caregiver schedule. So that kind of flexibility and accommodations is something I was really impressed by BioNews from the beginning, and it's something that is so easy to do that other companies can do, because I think that's the biggest like misconception and prejudice a lot of companies have had and still have in many ways, is like people with disabilities are a burden, and you can't that would be too much if they've got to go to appointments and stuff, when the reality is we can get just as much work done. And a lot of times we're more equipped to work faster and smarter because of the things that we've had to put up with in our lives. We're so used to being adaptable, flexible, thinking creatively, and we know how to work around problems, and that definitely plays into the jobs we do. So it's something that companies should really realize, that we're not a burden, and if anything, like we're probably more going to be more equipped and more resilient than an average employee.
Yeah, I really echo that. And I think also that our company cuts a very thick line between pitying a person and empowering them. And that's a huge thing for the disabilities community, where, either we're made to feel like a burden or we're the pity project that people, they might hire us to fulfill a diversity quota, or they might hire us because it makes them feel good. But every person at BioNews is absolutely qualified. It's absolutely people who are just incredibly strong. And a lot of that comes from their disease. That, it's simple psychology that when a person suffers, they're very good at empathizing. Or when a person is juggling, all these appointments and everything, they're very good with logistics. And so we don't see it as pity. We don't see it as burden. We see it as the people we're hiring are killing it right now. That our company is growing so rapidly, and it's on, the work of these people who we have empowered with leadership positions. People who they came in and, they weren't so sure that they could do their job because so many people told them over and over, oh, I'm going to have to let you go because you've missed too many days. Or, oh, you can't type well, then what are you doing in an office job? And instead we take them in, we're like, we're so excited because we know you have what it takes. We know that, you've been given all these opportunities and you've had them taken away. And so you're not going to blow this opportunity. And sometimes it's actually the opposite, where we have to tell our coworkers, like, no, you need to slow down. You don't need to impress us. You don't need to take on all this extra work. This is not that kind of workplace. And so, yeah, there's, like Kevin said, an expectation that, you do your job well. And we hire people knowing that they will do it well. And I think that's a very stark difference between us and many other companies, including some that I have been part of, where, instead it's people are secretly looking for ways to get rid of you. That is a very harsh reality. And there are way too many legal loopholes that allow for that. And there are too many loopholes that allow for us to be paid less than we are worth. And so, I think really every workplace needs to keep in mind not how am I, fulfilling the diversity quota, but how am I empowering people, and also having an eye for talent, where I can see that a person who has been through many, many challenges is a person who knows how to overcome, is a person who will be valuable to my workforce. So I love that about the company.
Brad, I was about to say, echoing what you said, I mean, if anything, we have to tell our writers and contributors to work less, because like, regardless of personality, most of them have that in common, that like they go so above and beyond, and we're like they're like, oh, I'm really tired, but I'm like, no, you need to go rest. Like you've done enough today. So that's more what we do day to day than anything.
Mm-hmm. Yeah, teamwork makes the dream work. We support one another when someone's hospitalized or they're really sick, and make sure that, yeah, the work gets done, and that takes team.
Wow, that sounds like a great place to be at. Hopefully we can push for more places to be that way, to empower. Okay, The other question that I have is there any disability policy you hope to see be brought forward by our new administration? Brad, do you want to start?
Yeah, sure. There's a lot I can't go into, but I kind of think of my classic example as kind of this domino effect where you start off with what I talked about before. You have the sub minimum wage, or you have people just not being hired despite, I think it's 64%, I think, of people with disabilities want a job right now and they don't get it. And so I don't know if you know this, but if you have a disease or a disability, it's very expensive. And that is a form of, undeniable ableism when you really think about it. That if you're born with bad genetics, or you develop cancer, or you get in some type of accident, you are charged more to live. That you are oppressed by the economy, that capitalism rides off of your back. And, it's distressing. It's distressing that, if you have a disability or a disease, that your family can go under because of you. Or that's what we tell ourselves, it's this terrible burden of thought. And, even told that we can't move to other countries because we would be a burden on their healthcare system. And a lot of this comes down to the pricing of medicine and of treatments. And right now we don't have the ability to negotiate with pharmaceutical companies. And right now we see that all these other countries are paying way, way less than America. That you don't even have to look at the insurance systems. You can look merely at the drug pricing. Gabby and I, for our disease within our community, there is a company called Vertex, and they make incredible, incredible medication that changes lives. And we're grateful for that. But some of the medications also cost $368,000 a year. And it's a pill, a pill that you take twice a day. It costs dimes to produce. And, maybe it's not too surprising that the CEO of Vertex Pharmaceuticals took home one of the biggest bonuses in his industry, millions and millions of dollars. I think he was the 6th greatest paid CEO in the US. It's just insane. It's mind-blowing when you really dig in and you go deep. And so for me, it's policy needs to target sub-minimum wage. We need to be paid a fair wage. We need to target, the ability for organizations like Medicare to negotiate for lower costs for drugs. We need to require drug corporations to disclose how, their money is dispersed, because they repeat this mythology that, oh, we need to charge a lot of money because research and development is relying upon it. And it's an absolute lie. It's a sham. That's not true. But that isn't made transparent to the public, and it needs to be. We also need to ensure that drugs that are based on science that is paid by the American tax system, our money, that, it's priced to affordability, that it's accessible for all. So for me, there are a lot of different policies that we need to target. There is this domino effect where it's not just your disease that you're struggling with. You also can't really catch a breath when it comes to money. That many of us fear ever having a family, because like what I said before, this paranoia that we are dragging people down. It's a very ugly system, a very corrupted system, and one that results in many, many people with diseases and disabilities going bankrupt, or even keeping themselves below the poverty line because that's the only way they're going to get assistance. And so it strips us of our autonomy, it strips us of our dignity, and we got to live, Just like all of you, we love to go to the movie theaters when there's not a pandemic. We love to eat good food. We love to take our family on vacation. And so it is absolutely, a good and righteous thing, I think, for people to be paid a livable wage, regardless of what genetics they're born with, regardless of what accident they got themselves into. And it's really just, treating each person as one who is worthy of dignity. And I think policies can reinforce that and keep people accountable.
Yeah, I'll echo everything Brad said and take it a step further by just to give you a taste of what it's like. So I mentioned, I have a caregiver earlier. I do live with my parents, and they also help me out. The biggest, and like when I tell people this outside the disability community, their minds are blown that this is still a thing. But so in order, obviously, caregiver needs to get paid. So in order to do that, I can't pay out of pocket entirely on my own. I do pay some out of pocket, but I go through Medicaid to get the majority of my caregiver's hours covered. And they first off, they give you a set number of hours based on their ridiculous standards anyway. So like, I mean, like when I turned 21 back in college, like my hours got cut, which is like it's kind of crazy that like the way they assess how many hours you get, basically the more independent you are, the less you get. Meaning like if you're independent, meaning like you're adult, you're working. That doesn't mean I still don't need someone to get me out of bed in the morning, get me to the bathroom. Like none of that changes. So because of that, so I'm given a set number of hours during the week, but also with that, I'm not allowed to have more than $2,000 in my bank account at one time. And so obviously that's not really a living way. And so even though I can get paid well at a job, but I have to, keep my bank account under that capstone. And then fortunately I'm in a situation where I mean I have very loving, supportive parents. Like I can pay rent. I'm happy staying here. I have a good setup, but that's what's going to happen. I've had the same caregiver, primary caregiver, for 6.5 years now, which is pretty unheard of in the disability community. I got really fortunate there, and we just developed a really good friendship right away. And fortunately, Randy stuck with me the whole time, and I've had others since then, but thankfully he stuck around. That's very rare, and the process of hiring and managing caregivers is very exhausting, and especially with the pandemic going on. I know several estimators who have gotten COVID through exposure to caregivers, even ones that are being careful. So that's another thing, yeah. But going back to the income thing, so yeah, it's like like my employers would love to. I mean, they pay me well. They would love to pay me even better, but I'm like, unfortunately, I'm at this cap because like I can't just eliminate Medicaid because I need that for caregivers. And so it's a constant just like figuring things out of survival, really. And like, again, I'm in a really fortunate situation, but I know others who they're on their own, they don't have the same kind of support that I do. And when that happens, they're very much struggling just almost week to week, day to day, trying to get enough caregiving hours, make sure there's people showing up. And so that's why you see so many people, particularly wheelchair users and others with disabilities, living at home, and because it's very difficult for us to manage independent lifestyles. And yes, I think we've come a long way. I don't want to like fully bash the system. There are many resources out there that are really great, and something I'm looking into now. I don't know enough about, but I am looking into an Able account. That's a program that does allow people with disabilities to put away money and actually make a decent living. That's something I'm not as knowledgeable about, but I'm looking into. And so, but yeah, it's a constant stream of loopholes that we shouldn't have to be dealing with. I mean, and another thing about the drug prices. So I've had really good experiences with Biogen, the company that makes the drug Spinraza. Thankfully I know pharma companies get bashed a lot. Thankfully, I've had a really great case manager there, had good experiences, but nonetheless, the drug that I get every 4 months costs 125,000 per injection, and that's just the drug. That's not doesn't even cover the appointment and the hospital facilities and all of that. So yes, money and all that. I mean, I feel like people know it's an issue, but they don't realize just how much it impacts us and how hard it is and how expensive it is to be disabled. Like, I mean, and so yeah, there's definitely like we've come a long way, but I think people outside the disability community think like, oh, that's all a thing that passed, ADA and everything fixed all that. It was a big step, but it certainly was by no means an end to all these issues. So we've still got a ways to go.
Yeah, for sure. And to kind of piggyback off of what you just said, our club is a big advocate for primary seasons. Clearly, we just did one for the 2022 governor and Senate race. Really, I highly recommend looking at their websites before you vote for a candidate and see their disability policy. Because, fun fact, this past presidential one, it was the first time a candidate put a disability policy. And the first one who did it was Elizabeth Warren. And then everybody kind of like copy and pasted. But just to be aware of. So the next question is, what is a last piece of advice you want to give about how we should all approach disability advocacy? Brad, you can start.
Yeah. So much of it just comes down to relationships, to really pursuing relationships and dialogue with people who actually have the disabilities. You'd be shocked by how many of these types of presentations and talks are led by people who don't have disabilities. Maybe they're caregivers or they worked in the healthcare setting. That's not the same as actually living with it. And that will never be the same. And so really, being able to empathize with someone by coming alongside them through their trials, through also the good parts to see what is working. And never assuming, we have a lot of different etiquette that goes into interacting with the disabilities community that intimidates people and makes them, beat around the bush and fear that they're insulting people. And really, sometimes it's best to just ask a person what are their preferences. That there are people who like to say that, I'm a disabled person, and someone who says I'm a person who has disabilities. And then we also have like caregivers and other people who try to involve themselves in the community and try to like slap labels on us. And that doesn't necessarily mean that we agree with them. And then, all sorts of different preferences on like, oh, well, when should I help you? When should I not? Relationship is a series of asking each other questions. That's how you get to know one another. And it's very much the same with disabilities. And, also just being aware of, it's never just a disability, that just like most things in our society, there's intersectionality, that we really need to pay attention to. Not every disabled person's experience is going to be the same as the other, that it is affected by race, it is affected by sex, it is affected by whether they're employed or not. And so it's really a wisdom act in that you have to build these relationships. And if you ever think like, well, I really have a person I can build a relationship with, connect with me. I'd love to put you with someone who says like, I get so frustrated by all these healthy and able-bodied people, like always making assumptions about me. I wish I could just tell them what it's really like. Because that's exactly what we try to do in my division at BioNews, where we're publishing the columns of people saying, this is what it's really like. Would you just listen? And I really do think that it's a rewarding friendship. That being friends with Gabby has been extremely rewarding. Being friends with Kevin has been extremely rewarding. They're both hilarious people. That when you face death, you come up with a very morbid sense of humor that is just absolutely delightful. And I just really am always pushing relational differences, that really relationships can solve problems that even policies cannot. That as people who are politically active, we also need to be relationally active, because hearing each other's stories is how we really pinpoint where we're supposed to be making a difference, where our callings are. And so I just want to encourage you that, if you see a person who uses a wheelchair, or you see a person who has cochlear implants, don't be afraid to be friends with them. Don't be so intimidated thinking I'll only step on their toes by saying something stupid. We get stupid remarks all the time. We are used to it. We want to be your friend. We want to show you what life is really like to have a disease or a disability. And so really for me, when it comes down to learning about disabilities etiquette and advocacy, the golden rule is never to assume and to establish relationships. That's going to be your strongest asset.
Yeah, no, I definitely agree with that as well. I mean, one thing that always growing up, whenever I saw a kid who would look at me, who was really curious, and they're about to ask a question, and then their parent says, "Oh, no, don't do that, don't be rude." I'm like, no, I want kids ask more. A lot of times, kids ask more intelligent questions than adults, because like what Brad said about the stupid comments questions, I've heard it all anyway, so don't be afraid to ask anything. Cause like, and so, yeah, I always encourage curiosity relationships because I mean, advocating for policies and everything is great, but but absolutely that you need to build those relationships first and really understand the experiences before you can actually do any kind of like, in the public kind of advocacy. And so, but yeah, I don't know. I always encourage kids and young people to be curious and to ask questions because, and I mean, the assume thing, when I just give an example of like the dumbest comments I ever get, so I had a service dog for a long time, and I mean, I kid you not, that one time someone at a hospital said this, like, and said, "Oh, that's a seeing eye dog," and I'm like, "Yeah, because I'm blind and in a power wheelchair." I mean, so like, they, the logic doesn't really enter people's minds. So, but it makes for great comedy material. So I don't mind the comments to an extent, but yeah, never assume, but ask questions. I mean, we don't bite, we don't run people over. It's like we're not some otherworldly being. So come approach us anytime.
Wow. Yeah, thank you so much for sharing that. We're going to open the floor now to anybody that has any questions. If you want, you can drop them in the chat or you can raise your hand or.
Also, as you're doing that, I just put Brad and Kevin's Instagrams in the chat. Go follow them. Yeah, I'm not saying maybe go follow them if you want, go follow them. Matthew, you can ask your question. I see your hand up.
All right. I wanted to thank you, obviously, for coming out here. I think this is actually incredibly informative, and to be perfectly honest, it's kind of cool. But my question is, what policies do you think the Democratic Party should push for in their platform to ensure that you live as independent of a life as you can?
I'll piggyback on what I said earlier regarding Medicaid. Just a way for for essentially wheelchair users and anyone with a disability who requires caregivers, a policy that allows you to work and make as much money as you can, and live independently while still getting the caregiving services you need. Like, I mean, I think it's just dumb that me and many others still have to be paying out of pocket in addition because we don't get enough hours allotted to us. So just I don't know how to phrase it or like but a call to action that would allow getting for anyone with a disability to get the caregiving hours they need provided for by the government, so that we don't have to pay out of pocket and we don't we can still work and we don't have a forced limited income because we need caregivers.
Yeah, and for me, tying into it again, the sub minimum wage, and then also the wage cap or income cap for getting Social Security disability insurance are just huge. Right now, we have the possibility that there will be a $15 minimum wage, and the disabilities community is kind of whispering, "What about us? What about us?" And that shouldn't be a compromise. It really shouldn't. Again, it's 420,000 people in America who are paid an average of $2.40 because they have a disability. It's a scandal. It's disgusting, and most people don't know about it. So I think that is absolutely an actionable item that will help people to achieve independence.
Thank you guys so much.
Also, if I could add to that as well, I think this is basically what Kevin said, but not allowing or not forcing disabled people to live in poverty in order to receive assistance. I think that's the biggest one. Hannah, you can go ahead.
Hi, thanks, Gabby. So I put a question in the chat, but I'll go ahead and read it out loud. What can UCF College Gems be doing to create a more inclusive environment for the disabled students at UCF?
It's a good question. I would say, I mean, things like this is great. I think just in inviting disabled speakers to come and do these talks is a great first step. And I mean, yeah, just making it more like, I mean, I never really joined any political organizations in college. Like I said, I worked for the school newspaper. and we're involved in other clubs and stuff. But yeah, just opening it up. I mean, and bringing it into the conversation. I think that's the biggest thing. Is like, we have multiple conversations in today's society about LGBTQA rights and racial discourse and all these things, which are great. But often the disability community gets kind of left out, and I think there are moves to make that better, but just bringing us into the conversation is a huge first step.
And again, I'm all about leadership empowerment. When I stepped into my first leadership role in University of Hawaii, the person inviting me to that position simply said, well, what would leadership look like with your disease? And I wasn't offended. Of course I know I have a disease. Of course I know it's going to affect things. Like, I'm not stupid. I was so, touched that she asked that question, because then I could tell her, well, yeah, the reality is that I'll be hospitalized a lot. The reality is that, I have this or that. And in this scenario, here's probably what we can do. Inviting them into a partnership of coming up with solutions rather than assuming there are no solutions is very important. And also, every campus does have a disabilities office. I don't know what it's called in most places. In Hawaii, it's called kokua, which means help. But you should be able to go to your office and look for that disabilities program and ask them, what can I do? And there are very practical things that you can do and even get paid for, like taking notes for people who are hospitalized. And then there might be, other projects where they might say, hey, you know what? We really need the school's attention on this matter, and we're not getting their eyes on this. What can you do to help me? And so I think that, it's a simple matter of asking the people who are interacting with the disabilities community the most in your local area.
Yeah, I forgot to mention that as well. I also had a really good disability services office when I was in college, and yeah, simply going to them, because at the least, whether a student is that active with them or not, pretty much every student with a disability that needs any kind of accommodations will have visited that office, and so that's a huge resource right there. Just to reach out to them and say, hey, we want to plug in more with disabled students on campus and see what opportunities there are to do. That's a great step right there.
Awesome. Thank you guys so much.
Thank you.
Olivia, I saw you put a question. I don't know if you want to read it or.
Yeah, sure. So my question is, how can we be better allies to the disabled community as individuals?
Yeah, so again, a lot of it is friendship. A lot of it is my rule that I was recently discussing with someone was, don't do nothing. I don't think, oh, that person's in a hospital. I feel awkward in hospitals, and I don't know what I'd actually do if I visited that person. It's just very weird for me. It's an unfamiliar environment. It's like, well, do something. Ask the person, like, hey, if I visited you, is there anything you'd want to do? As simple as that. Just the power of a good question. I think also, as individuals, just looking into different organizations that you can be a part of. For example, there's Cure SMA, which is kind of the organization nonprofit that's helping with Kevin's disease, and then the Cystic Fibrosis Foundation, and then one I really like for policy is Patients for Affordable Drugs. And so it's dominantly a patient-driven force that is all about, hey, let's lower these drug prices, that yes, insurance is a problem. Yes, personal finances are a problem. But at the end of the day, we also just simply need the medications to be affordable, because no matter how much money you make and no matter how cooperative the insurance companies are, there's no ways to justify that a medication can cost hundreds of thousands of dollars when it's absolutely essential to living. So I really encourage you to, do a good Google search and look into foundations like these and nonprofits, and look for practical ways to serve that. Nearly every one of these nonprofits has some type of regional office in Florida. And also just a lot of these have ripe opportunities for, Capitol Hill action, for actually coming to these politicians and saying, hey, this is my friend, here's a picture of him. He has a disease and he's at risk of being homeless because of your poor policies. Get in people's faces and tell them what it's really like, So I think as individuals, really, I hope that, the UCSF DIMS can do really cool stuff as an organization, but don't be afraid to look at other orgs too. I'm sure that, they're happy to share you. And yeah, be friends with people and know what kind of nonprofits they're part of too.
Yeah, definitely agree with all that. I mean, yeah, like I said, start with the relationships. I mean, granted, don't like just seek out the wheelchair user and say like, "Hey, can I be friends with you?" Yeah, but I mean, just noticing people and being friends and making those accommodations and like I said, yeah, I'm very active with Care SMA, which is a great organization, and is both advocacy and nonprofit, and I do a lot there. So but that's the thing is like a lot of times it's like yeah, it's like me and Brad are very connected with Bio News and with these different organizations, but like often it's like a bubble kind of thing where we would love to be more the conversations we have with each other, we would love to have with the wider society, and but yeah, just look for those opportunities, follow disabled people on social media. A really great book I would recommend would be Disability Visibility. It's like the anthology of essays that came out last year, edited by Alice Wong. That one's great. I'm actually leading a book club on that right now. So that's a really, I mean, resources like, I mean, there's a ton out there. The movie Crip Camp on Netflix is a really great documentary. So, it seems like that, like a lot of these things, like, Brad and I, we know all the time. It seems like they're kind of like hidden from larger society, but there are plenty of resources out there. So just build relationships, educate yourself, and those are really the best starting points.
Mhm. Yeah, and I think
Yeah.
also just like,
Sorry, go ahead. No, go ahead.
you go.
Okay. Well, I was just gonna add too, like all disabled people are subjective. Like even Brad and I have the same illness, and we have lived very different lives and have had very different treatment. So like if your distant cousin had the same illness as somebody and you meet them and you're like, oh my God, I know all about it. That's just sort of not a good thing to do. So that's my biggest piece of advice. But yeah, Brad, go ahead.
Yeah, I was just gonna say, just be a person who takes initiative and who takes the first step. Like Kevin said, it's not coming up to someone and saying like, "You're in a wheelchair. I want to be friends with you." But know that way more people than you might think have a disability or a disease, and they go unnoticed. As just kind of a short example, in my last semester of college, I was in an American Revolution history class, and there was a student at the front, and he had ASL interpreters, and so they were doing their sign language, and I learned nothing about the revolution because I was so transfixed, just thinking like, wow, I wonder what it's like to be deaf. I was still hearing at the time, and I just remember thinking like, gosh, that must be like all that this guy thinks about. That must be his entire world. And man, he must be so lonely. He must be so alienated. And I just sit there and wonder that for who knows how many hours. It was like a 40-hour class, and I never once approached him. And of course, maybe it's karma that just like a couple months later, after that class ended, I became deaf. And I found myself knowing that there were eyes drilling into the back of my head, that people were wondering why I was so rude by not answering when somebody said hello. Or people were wondering why I was so clueless when I was trying to order my food and they were saying over and over, we don't have that item. And I keep saying, fried fish, fried fish. And I wished more than ever before that I'd simply have someone reach out to me when I was alone in that coffee shop or when I was alone in that park and simply be a friend, because it was the most isolating experience of my life. That's not to say that you can't find extreme joy and fulfillment and also having a disease or a disability, because some of the most joyful people I know, people like Kevin, have a disease, have a disability. I'm very joyful. And that is another thing where people, they assume that your life must suck, just like I was doing for that deaf guy in class. And so, again, I just encourage you to take that first step, to not be intimidated, and know that a lot of us wish that you would ask those questions. A lot of us wish that you would approach us. And if we don't wish that, then we'll just ignore you or tell you to go away. That's okay.
And another thing I'll add to that is that one thing working for BioNews, meeting the cystic fibrosis community, is having an invisible disability illness is very different from my experience. And because obviously me, I stand out. I mean, I don't know if you can see it on my camera, but I have a Jayco robotic arm mounted to the side of my chair, which is like I use for like eating and drinking and stuff. And it's pretty awesome. I get when I'm out in public, I tend to get a lot of questions about that, which I'm happy to answer because it is pretty cool. And so like, but a lot of times that's a natural conversation starter. Whereas, and like, and from there, like I said, I'm very open. And so I'm happy to talk about answer questions and stuff. But learning from people like Brad with a more invisible illness has been really fascinating and educating for me, because that is a different experience. And so, yeah, a lot of times it's noticing that, like when someone needs someone to talk to, or just that kind of sense of being seen is really important.
Wow, okay. Thank you guys so much for sharing. So before we go, I want to ask if Kevin, Brad, do you guys have any organizations you want to plug? I'm about to drop the link for Bio News here in the chat. If you guys have anything else any other organization you would like to share? I know you guys shared a lot already, but do you have any other ones?
Yeah, I'll just reiterate CureSMA. It's curesma.org. So definitely check them out.
Yes, you sent that to us. I have the link.
No worries. Yeah, I think it's in our Instagram DM there. But yeah, they're great. And then
Okay.
yeah, I mean, I think Bio News you'll find just a lot of, just because that's probably the most diverse like collection of disease communities you'll find there. I'm not as much anymore, but have been in the past and involved with NDA, which is pretty popular. But and and some of the local ones there I like. So so that's another organization.
Yeah, and so I dropped the link for Patients for Affordable Drugs. That's p4ad.org. They're very good for policy. And again, there's the Cystic Fibrosis Foundation, which I forget I think it's just cff.org. And then there's also the Cystic Fibrosis Lifestyle Foundation, and they are all about just helping people with CF to afford things that can help them to exercise and get healthier lungs, whether that's a gym membership or a surfboard. And they're really great to donate to because you see exactly where your money goes. You're like, oh, great, that little kid who's now surfing because of my money. That's something that's like, really practical and really cool.
Hey, Brad, can you Google real quick and drop a link for Disability Visibility? Because they're like, I mentioned the book, but the editor of that, it's also like she has a podcast and it's like an organization too. So that's a really good resource.
Yeah, I encourage you guys to go on bionews.com, not because it's our company, but just looking at these different diseases and disabilities and viewing their stories is going to be way more helpful than just listening to the two of us. That, our best intentions, we still can only provide a narrow definition and experience of what it's really like to have a disease or a disability. And you're going to be way more informed when you read the stories of these many, many people with many, many different types of problems.
Also, I think Hannah dropped that link in the chat. So if that's it. All right. Well, thank you so much for coming. This has been amazing. Brad, it was so nice to finally work with you. This has been a long time coming for those of you who don't know. But yeah, so stick around because Dylan's going to come back up and he's going to talk about some current events that we have coming up. Yeah, there he is.
Okay, yeah, so before everybody leaves quickly, I'm going to share my screen again. I appreciate everybody that was able to come out today, but we just want to make you guys aware of just a couple of our events that we have coming up. So the first big one that you're going to see our graphic on Instagram posted about is our panel discussion on gun violence prevention. That's going to be this Thursday at 7 p.m. It's going to be a great event. We've partnered with the University of Tampa College Democrats to put on this event. And some of the speakers include our own local state rep, Carlos Guillermo Smith. And you guys might not know who Christine Hunschofsky is, but she's actually the former mayor of Parkland, Florida, as well as the current state rep for that area. So she will also be in attendance, and we were able to get representatives from March for Our Lives Florida and the Tampa area Moms Demand Action to also participate in this panel. And we could see a special guest member from the US Congress. We don't know yet. They tend to like to join events at the literal last second, so we may not know. Worst case, it'd be really cool if they did. If not, it'd be like that. Also, just to remind you guys that if you guys ever want to connect with any organizations or local representatives, we're here for that. We have resources and contacts. So if you're ever interested in working with any of them, you can come talk to us. Other things to just be aware of. We said it last meeting, but we're going to say it again, that we do have planned in early March a collaboration event with Volunteer UCF. We're actually meeting with them hopefully next week to finally lay the groundwork for that, but that will most likely be an in-person socially distant event. And that's something that you guys will be able to participate in. Also, be on the lookout over the next coming weeks, because we will be attempting to table on campus. It will be as socially distant as possible, mostly around we're going to trial run more likely next Tuesday. We weren't able to today because of just some logistical stuff, but be on the lookout for that. You can get some college Democrats at UCF swag and everything else, and just get to see us in person if you guys are on campus, as well as just be aware that we are hosting various caucus events throughout the spring semester. We just had a caucus event this past Monday that went very successfully, that you can actually see on our YouTube if you weren't able to attend, about the whitewashing of the civil rights movement. And we're hoping to have more events like that in the future, as well as just be aware that our general body meetings are bi-weekly on Tuesdays at 7 p.m. like it was today. So next week will not be in a general body meeting, but the week after. So with all that, the final thing again, if you haven't connected with us at all, be sure to do so. If you have, then we've reached the end of the meeting. I want to express our thanks to both Kevin and Brad for coming out today, and also to Gabby and Paola for putting this on. It was great. And I think Gabby wants to say something, so I'm going to pass it to Gabby.
I didn't want to say anything, but also now that I have the microphone, I did not realize how much Brad and Dylan look alike until right now, because you guys are right next to each other. So that's pretty funny.
It do be like that, yes.
It's an honor.
Yeah.
Thank you.
But yes, so again, thanks to everybody, and have a great night.